Hi, Dr. Luis Velèz with South Texas Renal Care Group. Today we're briefly going to talk about cross-contamination. That is, the transference of potentially infectious material from one surface to another. So, before we started this video, I had already put on my personal protective equipment. So I have my gloves, I have my gown, and I have my mask, right? So I'm ready, I'm safe. So before I do my patient encounter or go to the grocery store or what have you, I am prepared, right? I'm clean. Well, but before I go in, I get a phone call or I get a text. So I pick up my phone and I answer it. It's a doctor, it's important, right? It's about a patient. So I answer him. Okay. I've just contaminated my gloves, right? But then my nose itches. So now I have to adjust my mask and my nose is itching. At that point, I realized that I've contaminated myself, so I go to grab a wipe. You see what I've done. I have transferred potentially infectious material from one surface to another. Cross-contamination. This is what we were trying to avoid. Okay, in our last video we talked about cross-contamination. And as you see, I have dirty gloves and a dirty mask. So now I'm going to show you how you safely take these things off. So you see, the bacteria are on the outside of my gloves. So when I take my first glove off, I want to go glove to glove. I'll grab the outside to outside and I'll pull it off and it goes in the trash can. The second glove, skin to skin. Underneath the glove, you pull it out, off, inside out. Notice I didn't touch the outside of the glove, in the trash can. Now, I get my hand sanitizer because even though I had gloves, again, my hands are not sterile. I use my hand sanitizer. And you need to let it air dry completely for it to actually work, okay? At this point, you take off one side of your mask, like that. And then you reach on the other side and you take off the other side of the mask. And that goes in the trash. Again, you go for your sanitizer and you clean your hands again. Lastly, you let it air dry and you're done.